Thank you for presentation. Yeah, I am Dr. Duy from the Cardiovascular Center of Huế Central Hospital. Today I will present my topic with intervention in arterial pseudo aneurysm, techniques in different localization. Uh, the rising number of surgical and arteriographic procedures has increased the prevalence of pseudo aneurysm. And congenital angiography remains the gold standard for diagnosis. Doppler ultrasound, and MRI angiography, and CT angiography as a non-invasive detection. Over recent years, interventional treatment has evolved and largely replaced surgery in management. Several percutaneous and endovascular options, the choice depending on the feature of the lesion. The aim of the presentation, a case-based approach is used to be discussed pseudoaneurysm and their suitable treatment by interventional method. Objective of this presentation, we will use the six specific case to discuss pseudoaneurysm. What for? To the first is understand the cause and select suitable strategy and device. Second is share our experience managing difficult case at Huế Central Hospital. What is pseudoaneurysm? Pseudoaneurysm are common the vascular abnormality arising from defects in the arterial wall. Blood flows through the disturbed one into the surrounding tissue, creating a persistent communication between the artery and the adjacent cavity. Causes include inflammation, trauma, and exogenous factors such as the surgery, percutaneous biopsy, drainage, both catheterization may occur in any damaged vessels such as the carotid, extremity, and the visceral artery. Epidemic in the post-catheter pseudoaneurysm incident nearly the 2%, and the post-procedural pseudoaneurysm maybe the 2 to 6%. And large catheter and the peripheral anticoagulants and antiplatelet therapy increase the incidence. Ultrasound is useful, easy, and cost-effective. The place you ultrasound sensitive is more than the 90% and specific in nearly the 97% for peripheral pseudoaneurysm. In ultrasound, we can see the junction such as the to and fro flows. You see in the ultrasound, in the B mode, we can see the hypoequic sac, and then Doppler, we can see the junction sound. In CT, CT can the confidence for neck, chest, and abdomen, pelvis, and extremity, the pseudoaneurysm, and the limitation of the CT is the organism and the contrast, and such as the multi-artifacts. And the conventional angiography is a standard method for diagnosis and the best technique for the other mortality and inconclusive. With treatment, with some at a general such as symptomatic pseudoaneurysm should be treated with follow up an asymptomatic lesion. It may be thrombosed spontaneously. Option depending on size and location. US ultrasound guide compression, thrombin injection, arterial embolization, and endovascular stenting. In this session, in presentation, we focus on the endovascular stenting. The treatment is the first choice by bath and complication bleeding infection. Nowadays, with technical development, interventional option has taken first place in the treatment of the pseudoaneurysm. Surgical remain the gold standard for infected pseudoaneurysm, rapid growth, ischemia, neuropathy. And for the bath, in very divide in very big and large. We don't can inject it, the artery go to the lesion, but now we have many divide to closer and closer vascular such as the pro-line. From the abort, we can go to the artery and closer when we finish the procedure. I present the first case is patient for 40 years old, present with chest pain and history of hypertension. In the city, we can see that in city we can see the last aneurysm, pseudo aneurysm in the descending. In treatment for this case, we can use the we use stent graft for this case and combine with the surgery to extension the landing zone. We can see it in the angiogram. We put in the only one stent graft in the to cover the aneurysm. You can see it. When you stent, we put the stent graft in the 32 to 28. We can cover the graft rapidly. And the K2, with 28 years old female with the upper abdomen band related to the bed, history of the lower and the spinal tuberculosis. In the city, we can see the last aortic procedure as high risk abruptor, and it is the last of the pseudo aneurysm in the upper of the celiac church. In this case, we discussed with surgery. It's very difficult to approach by the surgical surgery. We can, but for intervention choice, we can put the stent in this for this patient. Intervention we in charge the stent graft with no bed stent and upper the celiac. It is a very good result for this patient, and when we follow in the 6 year, 6 months after, it is very good result. The case 3 is the 30 years old male with penetrated abdominal stent valves and surgical hemorrhage performed. In the CT, where the left retinal artery pseudoaneurysm in CT, we can see it is pseudo in the left artery renal. It is very difficult for the surgery to approach, but we choose the option for intervention. We can stand in for by the cover stand, such as the big rat in Vietnam. It will be you to assess the one for the advanced the stanting for big rat. This sit 30 sit 23 mm and the one asset for the angiogram. For the result, it very good. Be closer and eliminate the pseudo aneurysm for the artery renal. The case falls in the 35 years old with the chest injury from the deceleratoma. We can it causes the pleural damage performed. In the CT, we can see in image. We can see it's the aneurysm in the SMA. We can see the stand B graph for the 9 mm to closer eliminate this pseudo aneurysm. It for very good result for using it cover stand. The case 5, when 55 years old, the post-surgical rejection at the pancreatic head tumor. In the CT, we can see at the pseudoaneurysm at the high risk abruptor at the SMA. We can see this. In this, it's very difficult when we use the surgery by, but intervention we can approach it and pseudoaneurysm by the femoral access. We can use, we can see this pseudo aneurysm and the tear in the SMA. We put in the stent graft with Solaris in Solaris with diameter in 9 mm. We can see it run it, and it's sorry. It's a very good result. We eliminate the pseudo aneurysm in the SMA. The case the last case, the 50 years old male history of surgery at the pelvic abscess. The CT city, and we join the cover stand blade with the balloon angioplasty. In angioplasty, we can see this procedure in the iliac, and we can use it in cover stand for this patient. And we in in stand, and the final intervention with good results. And conclusion, in rising prevalence, the increase in social and arteriographic procedure has led to higher prevalence of the pseudo-aneurism resiliently. Diagnosis and optimal management are crucial. Untreated procedure carry the life-threatening complication. And and interventional treatment may be the alternative option with the lower morbidity and the mortality. Rebalance surgery in the many cases. Thank you for your attention. Yeah.